Alright guys, let's go ahead and get started. So, we are going to talk about chapter 22 today. And chapter 22 deals with diseases that affect the gastrointestinal tract, okay, or the GI tract. Most of these diseases are going to result in diarrhea and or vomiting. Okay? So if I don't say a symptom, that means it's probably just diarrhea and or vomiting. Okay? Also, most of these are going to be what we call self-limiting, which means they go away on their own without treatment. So they're often not going to be that series of infections. Okay? However, there are some notable exceptions to those, and we'll talk about what those are as we go. So what exactly is the GI tract? Well, it starts off with the mouth, the salivary glands, which are considered accessory organs of the GI tract, the esophagus, the stomach, the small intestine, the large intestine, the anus, and the rectum. Okay? The primary purpose of the GI tract is to bring in nutrients. Okay? So you take in food, you chew it up with your mouth, start digestion with saliva, and then it gets into the stomach. It's broken down further by hydrochloric acid, and then most of it will get assimilated through the small intestine. Okay? There are some accessory organs of the GI tract, the liver, as well as the pancreas. Okay? The liver produces enzymes for digestion as well as the pancreas. Okay? We're going to primarily focus on diseases that target the small and large intestine. Okay? And again, these are going to often result in diarrhea and or vomiting. Okay? We will also talk about some viruses that can target the liver, as well as some viruses that can target the parotid glands or the salivary glands. So again, it's made up of the mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, and anus, as well as the salivary glands, liver, gallbladder, and pancreas. Okay? And again, the primary purpose of the GI tract is again to bring in nutrients. Every time that you take a bite of food or a drink of water, it could potentially be contaminated with pathogen or toxins, and this is how these organisms then get into the body. Okay? It's mostly through what we call the fecal-oral route, which means contaminated water or food with feces that comes from an infected individual. As far as defenses go, they're relatively robust in the GI tract, and that's because this is where most of your commensals are going to be found in the body. Okay? So all of these defenses are going to be there to make sure those commensals don't, cause disease and invade into the body. Some examples of these defenses, things like mucus, so catching potential pathogen before they can cause disease. Parasitalis, or involuntary muscle contractions. This is used to keep food down. Okay? However, if you get sick or you ingest a toxin or a pathogen, these can go in reverse, and this is what allows you to throw up and get rid of the toxin. Hydrochloric acid. This is a caustic acid found in the stomach, which not only breaks down food, but can potentially kill pathogen. Bile acids are used for breaking down lipids. This also works very well at breaking down cell membranes of pathogens. Digestive enzymes are used for breaking down foodstuffs. Okay? Also could kill potential pathogen. GALT, or gut-associated lymphatic tissue. This is the lymphatic tissue around the GI tract where you find about 50% of your immune cells. Okay? And so you have the vast majority of your immune cells in this one area. And then IgA, this is an antibody secreted at mucus, so you would expect this since there's mucus present. And again, this is for neutralizing infections before they occur. As far as normal biota go, there are a lot. Okay? Just in your mouth, you've got about 550 different species, and in your GI tract, it varies greatly from one person to the next, but it's usually thousands of species. Okay? These are primarily there to ward off pathogenic diseases by taking up space. Okay? Like we talked about in it was chapter 11. Now, when you look at the feces that is released from the body, about 30% of it is actually dead organism. Okay? So the vast majority, or there's a lot of microorganisms in your gut, and this makes up a minority of your feces. So let's first start off with the mouth, okay, and more specifically the teeth, okay, and the connective tissue that holds the teeth in place. So a little bit about teeth. They are primarily made up of 3 layers, okay. you've got the enamel up at the top, which is calcium chloride, kind of bone-like or hard material. Below that you have dentin, which is living tissue, and this is vasculated by blood vessels as well as nerves, which are found within the root. Okay? If you were to get an infection in the tooth, okay, and it eats away at the enamel, gets into the dentin, this will cause pain. Okay? And then if this works further in and makes its way to the root, this will cause an abscess, which usually requires the tooth be removed or a root canal performed. Now the teeth are held in place by a periodontum, which is basically tissue and bones. Okay? The tissue is known as the gingiva or the gums. Okay? And so the gingiva hold it in place, and then the bone around it keep it solid. Okay? Now one of the most common infections found in humans is something known as a dental carie. Okay? A dental carie is essentially a cavity, and this is where you have normal commensals in your mouth growing and forming biofilms on your teeth, which then allow them to leach acid into the calcium chloride of the enamel, breaking it down and causing little pockets to form. Okay? When this happens over and over and over again, this can leach away the calcium chloride until it gets down to the dentin, and this causes a cavity and pain. Okay? This is the most common infection in humans because these guys are commensals in every single one of us. Okay? They are not pathogens, this is just a normal process. Now, because we eat a lot of refined sugar and things, these guys grow a little crazy. Okay? In prehistoric times, we wouldn't eat this much refined sugar, and so these guys would be kept at bay, and cavities wouldn't form as frequently as they do now. So the most common organism that causes caries or cavities is Streptococcus mutans. And what this organism does is it breaks down glucose and fructose, okay, both of which are simple sugars. When it does this, they become glucan and fructan. These become very sticky polymers, which then allow the organism to adhere to the teeth, causing a plaque. Okay. Because these guys are metabolically active, they're releasing acid. This acid will leach away the calcium and the calcium chloride found within the enamel, and this starts to cause a little pocket or hole to form in the enamel. The best way to prevent this is to brush your teeth. Okay? By brushing your teeth, you're going to remove away this plaque, reducing the amount of acid and saving the enamel. Okay? Also, you can ingest fluoride, which we get in our drinking water, and this will replace the the chloride and calcium chloride with fluoride, which is a much more stable, hard compound. Okay? And it's less likely to be leached out. Periodontis. So periodontis is inflammation of the periodontum, which is essentially the bone and the connective tissue or the gingiva surrounding the teeth. Okay? Now, periodontis or inflammation of this tissue is not that common, but gingivitis is. Okay? Gingivitis is essentially inflammation of the gingiva, okay, or the connective tissue. And this is a relatively common phenomenon. In fact, most of us have at least some level of gingivitis at any given time. Okay? This occurs when you have normal commensals growing on the gingiva. This causes a mild immune response, and you get a little inflammation. Okay? Now, a little bit of gingivitis isn't that big of a deal, but if it becomes more progressed and it sticks around for a long period of time, then this can cause chronic, kind of severe inflammation. And what this does is it causes the bone beneath the gingiva to recede. Okay? And when this happens, the bone then disappears, it can't be reformed, and then your teeth, actually, the roots and things start to become exposed, they can fall out, it can get pretty nasty. Generally speaking, though, the best way to prevent this is to brush and floss your teeth again. Okay? Removal of the bacteria from the gingiva is going to greatly reduce the likelihood of this occurring. Okay? So here is an example of advanced periodontal disease. So you can see here the bone itself has receded greatly. This bone should be all the way up here. And what you'll notice is that now you're exposing kind of the root of the tooth, which doesn't have very much enamel on it. So it's very, very susceptible to getting caries, which can then become serious and often result in an abscess. Okay? Again, this only really happens if you don't brush your teeth or take care of your teeth. But like I said, a little bit of gingivitis is relatively normal. It's this advanced stage periodontal disease, which is not. Necrotizing ulcerative gingivitis. This is where you get gingivitis caused by a pathogenic organism. Okay? So instead of it being a normal commensal in the mouth, now it's an organism that can actually burrow into the gingiva and cause ulcers. Okay? This can be very painful. It can cause a much more advanced, more rapid form of gingivitis and periodontal disease. Generally speaking, our immune systems keep these organisms at bay. So this is, again, something you would probably see in someone who's immunocompromised or someone that just does not take care of themselves at all. Okay? Generally, this is what we would see in someone who is a drug user. Okay? That just does not take care of themselves, have proper hygiene, anything like that. So I'm sure you guys have heard of meth teeth before. Meth teeth are usually associated with this necrotic ulcerative gingivitis. All right, so enough of the teeth. Now let's move to the salivary or parotid glands. So the salivary glands are 4 glands located kind of in the back of the neck, or the back of the jaw. And they're there to produce saliva, which help kind of lubricate the GI tract and start to break down foodstuffs. Okay? Now these can get infected with one pathogen, and that is mumps. Mumps is a viral infection. Okay? It's an incubation period of about 2 to 3 weeks. Then it causes a generalized kind of flu-like illness. But the telltale symptom of that you have mumps is that your parotid or salivary glands enlarge about 10 times in size. Okay? So it creates something called a gopher-like swelling, and this is where you get this big kind of like sac of inflamed tissue right around the neck. Now, generally speaking, if you're a young kid, so before puberty, this is a relatively harmless infection. Gets in, causes a little bit of swelling, a little bit of pain, a little bit of flu-like illness, and then it goes away. Okay? However, if you are an adult, okay, or someone after the age of puberty, and you get infected with mumps, then it can cause a more serious illness because it can make its way to the testes or other genital organs, and they get swollen about 10 times, so it's not a lot of fun for guys. They can get into the thyroid gland, pancreas, the brain, the heart, and kidneys. So it can cause a much, much more serious disease. The good news is that we don't really have mumps that much anymore, at least in the United States, thanks to the MMR vaccine. Okay? Measles, mumps, and rubella. So here you can see an example of this gopher-like appearance, these big kind of puffy neck region. It's pretty painful, okay, because these parotid glands swell very, very significantly. Why does this happen? Well, measles causes something called synesthesia. And synesthesia is essentially where you have multiple infected cells in one area that fuse together, forming a giant multinucleated cell. When this occurs in the parotid gland, it causes a very severe immune response, and this is what results in that edema and inflammation. All right, so enough of the parotid and salivary glands. Let's work our way down. Now we're going to skip over the esophagus because there's not much that infects the esophagus. And now let's go to the stomach. Okay? There's only one pathogen that we know of that actively targets and infects the stomach, and that is a bacteria known as Helicobacter pylori. Helicobacter pylori has the ability of burrowing into the stomach lining and then creating a little buffer zone around it to protect it from the hydrochloric acid in the stomach. Okay? Now this is a commensal found in about 50% of us. Doesn't really do much to most of us. However, in some cases, if your immune system responds to this organism, it will cause something called gastritis. This is inflammation of the gastric tissue. Okay? This causes an immune response, which then can break down the mucus layer, protecting you from the hydrochloric acid. And this acid then can kind of leach in and cause something called an ulcer. Okay? An ulcer is where you have acid kind of eating away at your stomach tissue, and this obviously can be pretty painful. Okay? Now, when this was first discovered in the 90s, it was a really big finding, because up until this point we thought ulcers were caused by environment and genetics. In reality, what we found is that about 90% of ulcers are caused by this organism and can readily be treated with antibiotics. Okay? So it resulted in a significant amount of ulcer cures. It's important to cure ulcers that are caused by H. pylori, because it does greatly reduce your chance of getting stomach cancer if you do not. Okay. So the organism, Helicobacter pylori, is unique because it produces something called urease. And this urease can break down urea, and when urea is broken down, it becomes ammonia. Okay? This ammonia has a high pH, which can neutralize the low pH of the stomach. This creates a nice little neutral zone around the organism, and this is what allows it to survive in the caustic stomach environment. Again, it's relatively easy to treat nowadays. You take antibiotics with a proton pump inhibitor, which reduces the amount of acid in the stomach for a month or two. Okay? Most people will recover from this. Okay, so now we're moving on to the small and large intestine. And this is where the vast majority of the rest of the chapter is going to be. Okay? As I said before, most of the infections in this area are going to cause diarrhea with or without vomiting. Okay? Now, there's a lot of diarrheas, so what we're going to do is we're going to break them up into groups, whether they're acute or chronic. Okay? Acute diarrheas, that generally means they last for less than 2 weeks. Chronic means they last for more than 2 weeks. Okay? In a healthy individual that has a competent immune system, most of the diarrheas are going to be acute. They go away in about a 2-week time period or less. If you're immunocompromised, especially if you have HIV/AIDS, that's when you're susceptible to getting the more chronic varieties of diarrhea. Now, as I mentioned before, most of these diarrheas are going to be self-limiting, which means you get rid of them on your own. In fact, if you actually take antibiotics, oftentimes it can make it worse. So it's better just to let nature do its thing. There are some exceptions to that. So a certain strain of E. coli, E. coli 0157H7, can result in more serious illness, which can result in a kidney failure in about 10% of cases. Okay? But generally speaking, most of these are going to be self-limiting, go away on their own, and not cause any serious damage. So we'll start off with Salmonella. So Salmonella primarily causes something called salmonellosis. And this is the non-invasive form of Salmonella infection. This is where the organism gets into the small intestine, attaches itself to the microvilli of the intestine. This causes inflammation and then eventual diarrhea. Okay? It lasts for 2 to 5 days. You may get a little vomiting with it as well. It causes a lot of cramping, a lot of pain, but it's not generally considered life-threatening. Okay? However, there are some flavors of Salmonella organism that can then penetrate through the small intestine, get into the bloodstream, and cause a systemic disease. Okay? This is known as typhoid fever. It's similar in symptoms to salmonellosis, but you have a fever, hence its name, and it can work its way further into the body, getting into lymph nodes and the bloodstream, and even potentially causing a septic infection. Okay? So this guy could potentially be life-threatening. Okay? However, it generally doesn't occur unless you have a slightly weakened immune system. Okay? Either really young, or really old, or the immunocompromised. So, typhoid fever is caused by a subvariant of Salmonella known as Salmonella typhi. Historically, this was the first pathogen that we discovered something called a chronic carrier with, and that was a woman named Mary back in the 1850s. She's now called Typhoid Mary. Essentially, she was a chronic carrier of Salmonella typhi, which means she had no symptoms, but she was infected. She also happened to be a cook, so she infected many, many people with Salmonella typhi over her career. They tried to get her to stop cooking. She refused, and she eventually went to jail for it. So, the moral of the story is, don't cook if you have Salmonella typhi. Salmonella species, so this is all the other flavors of Salmonella. And again, this is the non-invasive form. It's usually not life-threatening, but it's not fun to have. Okay? The good news is Salmonella typhi is very rare in the United States, as you can see here in the orange line. It's very sporadic. We see it maybe a handful of cases a year. Okay? It's usually due to some sort of breakdown in our hygiene protocols. Okay? But it's very, very rare. Salmonella species, though, we do see outbreaks of this every now and then, and these are usually associated with contaminated poultry products. Okay? Birds in general carry Salmonella as a commensal, okay? And so it is possible for you to get it on chicken and eggs and things like that. And that's why they recommend you cook chicken all the way through. Shigella. So Shigella causes something called dysentery. Dysentery is essentially bloody diarrhea. Okay? So it's a lot of fun. It's relatively uncommon in the United States, and that's going to be true with most of these diarrheas. And the reason for that is these are transmitted through the fecal-oral route. In the United States, we're very hygienic, and we make sure we separate our feces from our drinking water and food. However, they still do occur sometimes if you go to Chipotle or some places like that, right? All it takes is people not washing their hands, and it allows for these things to spread. So this causes frequent watery stools with fever, abdominal pain, and blood, okay? And occasional vomiting. So how exactly does this blood occur? Well, it's because the organism produces something called the Shiga toxin. This is an AB toxin. So remember, AB toxins have two subunits. The B subunit allows it to bind to the cell and then enter the cell. The A subunit is what actually kills the cell. The Shiga toxin targets the epithelial cells in the large intestine. This causes them to die and then forms these little ulcers. Okay? These ulcers then bleed, and this is what causes the dysentery. Now, generally speaking, if you're healthy, it will cause a little bleeding, but nothing else. Okay? It's not going to invade further. If you are immunocompromised, though, the organism can invade further and could potentially cause a septic infection. E. coli. So E. coli is a normal commensal found in all of our guts. Okay, relatively healthy to have. However, occasionally E. coli can pick up virulence factors and become pathogenic. So there are many different flavors of E. coli that can become pathogenic. Your book talks about all of them, but we're only going to talk about one. Okay, and that is E. coli 0157H7, also known as enterohemorrhagic E. coli or EHEC. This organism we're talking about because this is one of the few bacterial diarrheal diseases that can actually kill you. Okay? And that's because the organism produces something called a hemolysin, and this is essentially a toxin that lyses red blood cells. So it can burrow through the small intestine, get into the bloodstream, release this hemolysin, and this causes something called hemolytic uremic syndrome. This is where you have a ton of red blood cells that are dying at once, and this gums up the kidney, causing kidney damage and potential kidney failure. Okay? And in that case, you either need a kidney transplant or you die. Also, occasionally this toxin can cause neurological problems, blindness, seizure, and stroke. Okay? This hemolytic uremic syndrome, or HUS, occurs in about 10% of patients that become infected with this. And so this is why whenever there is an E. coli outbreak, you hear about it all over the news, there's recalls everywhere, because this could be the potential pathogen. Campylobacter. So Campylobacter is the most common form of bacterial diarrhea in the United States. Okay? It's the mildest, which is good news for us. It usually results in a diarrhea type disease with maybe a mild fever, some vomiting, and it can last for about 2 weeks, maybe a little bit longer. It does remit and recur, which means it goes away, or if you think it goes away, and then a couple days later it comes back. It goes away, a couple days later it comes back. So a lot of times people get infected with this and don't even fully realize it or appreciate it because of this remit and recur cycle. So it's caused by a bacteria known as Campylobacter Jejuni, okay? And this is, the most common cause of bacterial diarrhea in the United States. It's relatively harmless, it doesn't penetrate through, it doesn't cause any more serious infections. However, it does have one problem, and that is that it can potentially cause more GBS, or Guillain-Barré syndrome. Okay? Guillain-Barré syndrome is an acute paralysis, which means rapid onset paralysis. The way that we think this occurs is due to an autoimmune reaction. So there are proteins on the surface of Campylobacter that look a lot like the proteins on your myelin sheath. Okay? Myelin sheath are special cells that are fatty, and they create kind of insulation around your nerves. What happens is when your immune system targets Campylobacter, produces antibodies to it, and these antibodies can then cross-react with the myelin sheath. When this happens, your immune system kills the myelin sheath, and this results in paralysis. Without myelin sheath, you can't potentiate a signal down the nerve, and then your muscles stop functioning. Okay? The good news is that it is reversible, and oftentimes it does reverse itself, because the myelin sheath can regenerate. Okay? So it's an acute paralysis, but it's often temporary. C. diff, also known as Clostridium difficile. This is a normal commensal found in about 40% of us. That's relatively harmless until the rest of your microbiota in your gut are destroyed. Okay? This can occur either because you are taking heavy doses of antibiotics, which C. diff is often resistant to, or your immune system starts to fail for whatever reason. Okay? This organism can produce toxins, toxin A and toxin B, and these result in pseudomembranes to form in the large intestine. These pseudomembranes look like this, so these little kind of tire patches that form, and this results in diarrhea, abdominal discomfort, and not a lot of fun. Okay? The diarrhea that results from C. diff tends to be very distinct, kind of greasy, has a very distinct odor, and it's known to persist for long, long periods of time. Okay? And that's because C. diff in general is pretty difficult to kill. It is a prolific endospore former, which means even if you take antibiotics, it can become an endospore and survive that. So one of the easiest ways, and one of the better ways, at least that's what they're finding now, is to actually do something called a fecal transplant. This is where we take feces from a close relative and then put it back into your large intestine. This will repopulate the normal commensals in the area, and this then outcompetes C. diff, and then the infection goes away. Okay. Vibrio cholera. So Vibrio cholera is another bacterial diarrhea, and it's caused by the Vibrio cholera organism. Vibrio just means it's a bent rod, so it looks like a boomerang under the microscope. It has a relatively short incubation period of a few hours to a few days, and that's because it's a toxin that the cholera organism produces that causes the diarrhea, the cholera toxin. Now this diarrhea isn't normal, and that's because it tends to be very, very, very watery. Okay? We call it rice water stools. And that's because it's mostly water with a little bit of whatever's in your gut. In fact, you can lose up to 1 liter of fluid an hour in severe cases of cholera. So cholera used to kill a lot of people, okay, before the advent of modern medicine, when we realized, hey, if you're losing that much water, maybe we should give you some treatment. Now, it's primarily transmitted through contaminated water, so water contaminated with feces. Okay? So the best way to prevent cholera is to segregate feces from potential potable or drinking water. Now, the reason this organism causes so much diarrhea and so much water release is because of the way the cholera toxin works. Okay? It is also an AV toxin, so it binds to large intestine epithelial cells. And before it kills the cell, it causes the cell to release all of its goodies into the large intestine. Okay? What this does is it takes all the salty contents of the cell and pours it into the large intestine. What this does is create something called salty gut. And what salty gut will do is it will then suck all the water out of the normal cells in the large intestine through osmosis. This results in a ton of water leaving the body, and this can ultimately kill you in a couple hours if you don't rehydrate. Okay? So the best way to get over the cholera infection is to rehydrate, drink a lot of water with electrolytes over a week or so until the organism is removed.
How common is that infection?
Yeah, and nowadays it's very rare, at least in developed countries. In developing countries, we still see it. Again, the best way to prevent this is just to segregate dirty water from clean water. In fact, one of the first epidemiological cases was centered around cholera in the late 1800s. They found a lot of people drinking from one well were getting cholera. So they looked closer and they saw that there was shit going into the well. So they segregated the shit from the drinking water, and now they didn't get cholera. Okay? It sounds like, dumb to us now, but back in the day, you didn't really think about it most of the time. Cyclosporidium, okay, so Cyclospora. This is a protozoan organism, okay, so eukaryotic protozoan. Now, it causes a relatively mild form of diarrhea in most people. However, if you are immunocompromised, the organism can cause a chronic diarrhea, which could potentially be life-threatening. Okay? But in a healthy individual, it's a mild diarrhea. Most of the time, no treatment is necessary. So it's a protozoan disease, and it's transmitted through something called an oocyst. These are basically the eggs of the protozoan organism. And these eggs are extremely, extremely hardy. Okay? So the chlorine found in our drinking water is not enough to kill these organisms. So the only way to get rid of them to prevent their transmission is to filter or mechanically filter out these oocytes. Okay? Generally speaking, this is rare in developed countries, especially in the United States, because we filter our drinking water during the water treatment process. However, there have been outbreaks that have occurred. The most recent one was in the 90s in Milwaukee, Wisconsin. There was a pump failure and their dirty water mixed with their clean water. It resulted in about 20% of Milwaukee getting cryptosporidium infections. And I think they had about 80 deaths from it. Okay? But again, the deaths are going to be in people who are slightly immunocompromised. So they're really young, really old, HIV/AIDS, things like that. Rotavirus. So rotavirus causes gastroenteritis, which is nonspecific inflammation of the GI tract. Okay? Rotavirus, like all GI viruses, is a non-enveloped virus, which means it's extremely hardy. Okay? So if you go to the bathroom, you get a little of this on your hands because you didn't wash your hands properly, and then touch the table, that organism can live on the table for months at a time until someone comes around, picks it up, ingests it, and then gets infected. Okay? It is notoriously hard to kill, even with chemicals. So that's why it's just better to wash your hands and get rid of it before it gets on an inanimate object. It causes watery diarrhea with fever and nausea, and it's primarily seen in children. And that's because once we get this once, we develop immunity to it, and it's less likely for us to get it later in life. Okay? So it's mostly seen in children. However, there are many viruses that can cause gastroenteritis. These can be viruses in the adenovirus family, norovirus, or astrovirus. These are relatively common, and that's because it's hard to get rid of these guys from contaminated things, okay, especially water. Viruses are very tiny, so it's difficult for us to filter them out all the time. Okay? But again, we know how to segregate waste well enough that it's still relatively rare. One of the more important of these viruses that can cause gastroenteritis are noroviruses, also known as Norwalk-like viruses. They are named after Norwalk, Ohio, which is just, about an hour away from us. And that's where the first case of this Norwalk infection occurred. Causes gastroenteritis similar to rotavirus. However, instead of primarily targeting children, Norwalk-like viruses target adults. And that's because, for whatever reason, we don't develop full immunity to it, so we can get reinfected with it over and over and over again. This is primarily associated with outbreaks that occur in close quarters, like in schools or on cruise ships. So whenever you hear of a cruise ship where a bunch of people got vomiting and diarrhea, chances are it was a Norwalk infection. Okay? Now these viruses are also non-enveloped, which means they're very, very hardy. And so that's why when you go on a cruise ship, it always cracks me up to see the little guys squirting hand sanitizer in their hands all the time. Because that hand sanitizer does nothing to kill this virus. Okay? The reason why it bothers me a little bit is because I think it makes people a little complacent. And so maybe they won't wash their hands as frequently, and instead they just trust the hand sanitizer. Reality does nothing. Okay, so now we're going to move on to acute diarrhea with vomiting. Okay? And this tends to be caused by something called food poisoning. This is where instead of ingesting the bacteria, you are ingesting a preformed toxin that the bacteria produced in your food. Okay? This results in a very violent form of vomiting and diarrhea. And it tends to happen very rapidly, so within an hour or two after ingestion, but it resolves itself very rapidly as well, usually within about 24 to 48 hours. So if you ever hear anyone say that they had a 24-hour stomach flu, tell them to shut up. They had food poisoning. There's nothing called the 24-hour stomach flu. Okay? There's no flu out there that lasts for 24 hours. Flus last for weeks. You have no idea how many people will try to say, no, that was a stomach flu, so they can go back to that same restaurant again. No, it was the food you ate at that restaurant. Don't eat there again. All right. Staphylococcus aureus. Okay, so remember earlier I told you S. aureus is found in pretty much every chapter, and that's because it is a pretty good pathogen, right? It produces a lot of virulence factors, one of which are toxins which it can release into your food. Okay? These toxins are heat stable, which means that even if you heat your food up to a high enough temperature to cook it, the toxin can still survive. Okay? And this is why you always want to store food at the proper temperature, okay? Below 40 degrees Fahrenheit or above 140 degrees Fahrenheit. If you store it at the temperatures in between for more than 2 hours, the organism, if it's present, could potentially grow, release toxin. You can't get rid of the toxin even by heating it up, and so if you ingest it, you can get food poisoning. This results in cramping, nausea, vomiting, and diarrhea. Usually occurs in 1 to 6 hours and goes away in 24 hours. Okay? It's completely harmless, but it sucks having it. Okay? It feels like you're going to die, but trust me, you will not. Bacillus cereus. So this is a bacillus organism that grows on cereal grains. Okay? That's why its name is Bacillus cereus. It's primarily associated with rice. Okay? It is a prolific endospore former, which means that if it's on your rice as an endospore, even boiling your rice is not going to kill it. Okay? It produces 2 types of toxins, a diarrheal type and the enteric. Enteric just means vomiting. And note that the enteric version is heat stable, so even heating it will not get rid of it. This used to be associated with fried rice, because what some establishments did is they would make big batches of fried rice, okay, and then move it over to just the warm part of the grill, so where it wasn't being kept up to proper temperature. This allowed this organism to wake back up, release toxins, and then whenever someone ordered fried rice, they take a little bit off, heat it up real quick, and then ship it out. Okay? But if the toxin's there and it's heat stable, that heating up did nothing to get rid of it, the person ingests it, it's food poisoning. Okay? So I can tell you right now that is against proper practices, and if they got inspected by the health inspector, it would be a big no-no. Okay? So we don't see it too much anymore, but it could potentially happen. Clostridium perfringens. So Clostridium perfringens we talked about before. This is the organism that causes gas gangrene. Okay? It causes gas gangrene by releasing toxins that destroy tissues. Well, if that toxin gets released into your food and you ingest it, it causes food poisoning. Okay? It's not very serious. It's just like any other food poisoning. However, it tends to have a little bit longer incubation period. Okay? But again, you have a rapid recovery and you feel better. All right, so now on to the chronic diarrheas. Chronic diarrheas are diarrheas that last for more than 2 weeks. Okay? And again, these chronic diarrheas typically do not occur in healthy individuals. Instead, this is something you would see in an individual who is immunocompromised. Usually if they have HIV/AIDS. So a lot of these are going to be AIDS-defining illnesses. So the first one is enteroaggregative E. coli, or EAEC. This organism causes aggregates, which are just a big clump of cells. Okay? These form around epithelial cells within the small intestine. This causes a lot of mucus to be produced and a lot of diarrhea. Okay? So it's pretty easy to tell because if there's mucus, a lot of mucus in the diarrhea, it tells you it's probably this organism. Again, because it is so aggregative or kind of sticky together, and this allows it to produce things like biofilms, which make it difficult for the immune system to get rid of or the body to kind of scrape away. And this is why it can last for a couple weeks. Cyclospora. So Cyclospora is a protozoan organism that can cause diarrhea. It was discovered not that long ago, and that's because it really doesn't do much in a healthy individual, right? A lot of us probably get infected with this on a regular basis because this organism is found all over in soil and places that we eat frequently. However, if you are immunocompromised, it can cause diarrhea, stomach cramps, bloating, and in some cases this can form a chronic version of diarrhea that can be very, very difficult to treat. Giardia. So Giardia lamblia, that's this little guy here. This is another protozoan organism. And it has, did you say it's cute?
I said I thought it had a face.
Oh.
With a little
So this isn't a good representation of the organism. Let me see if I can find it.
Doesn't say anything else like
Because I've had people say it looks cute before, but wait until you see what it really looks like. So this picture that you see here is an electron micrograph, but this is showing it attached to the small intestine. Okay? And so what it does is it uses these little suckers to attach that irritates the gut and causes diarrhea. But if you look at it when it's not attached, there's a really famous picture where it basically looks like a deflated, like creepy looking clown. Gets these really big looking eye things and like this weird misshapen mouth.
Just because you don't want to
I could find it. I'd show it to you. These are all like not the... To me, it always reminded me of a horseshoe crab. Oh well, one of these days I'll find it and put it in the slide. Oh, there's a kind of it, but there's one that's even creepier than that. Well, anyways, what it does is it uses those little sucker things, or what look like eyes, to actually attach to the small intestine. Okay? This irritates the gut and causes diarrhea. In most healthy people, this is a mild diarrhea. You get rid of it on your own, no big deal. However, if you're immunocompromised, these organisms grow out of control and they just cover the entire intestine. Okay? This causes a very chronic form of diarrhea that is very, very, very difficult to treat. Okay? Generally speaking, though, it's not going to be life-threatening. However, it is going to be a pain in the ass for people who are immunocompromised. Okay? It's something they'll have to deal with for a long period of time. The jokes are endless, aren't they? Entamoeba. So entamoeba is another protozoan organism, and this is a amoeboid organism. Okay, so it's like an amoeba. This organism, once you ingest it, can then work its way into the small and large intestine, where it then can perforate or burrow into the large intestine itself. So it's often associated with something called amoebic dysentery. Okay? So amoeboid organism causing bloody diarrhea or dysentery. Now again, if you're a healthy individual, chances are your immune system will stop it and it won't cause any more serious disease. If you're immunocompromised, though, the organism can work its way further into the body, infecting the liver, causing hepatitis, or get into the lungs and cause pneumonia-like illness. So again, it's an amoeboid organism which forms a cyst, and the cyst is what allows it to persist in things like water and on surfaces. You ingest the organism, it then can burrow through the large intestine, and if you're immunocompromised, this organism just grows out of control, and it causes something called Swiss cheese colon. And this is where it basically just destroys your colon. Okay? This is an example of what it looks like, and at this point, there's nothing you can do except resect or remove this portion of the colon. But again, not seen often in healthy individuals. All right, so enough diarrhea. Now let's move on to hepatitis. Okay? Hepatitis is inflammation of the liver. Now, many things can cause inflammation of the liver, including drinking alcohol. Okay? But what we're going to focus on are viruses that can cause hepatitis. Now, one of the signs of having severe hepatitis or inflammation of the liver is something called jaundice. And jaundice is a buildup of bilirubin. Bilirubin is a byproduct of red blood cell death. Okay? It's toxic, and so the liver's job is to remove it. If your liver is inflamed and not functioning properly, then this bilirubin doesn't get removed, and then it can build up and cause yellowing of the skin, or yellowing of the sclera, or the white portion of the eye. So there are 3 viruses that can cause hepatitis. The first one is Hepatitis A, and this is the only one that can be transmitted through the fecal-oral route. Okay? So you get this from eating contaminated food items, usually. In general, this is the milder and the self-limiting hepatitis. Okay, so if you're going to get one, this is the one you want. It causes flu-like symptoms with a severely swollen liver, a lot of pain and aches, and dark coffee-colored urine. Okay? That's usually the sign that you have hepatitis A. This lasts for 2 weeks and then spontaneously recovers and you're fine. Okay? It's not life-threatening. I think it only has like a less than 1% mortality rate. And it is not oncogenic, which means it does not change the liver in any way, does not make it cancerous or anything like that. Okay? Generally speaking, though, we don't see this too often in the US because of our hygiene practices, but also because there is a hepatitis A vaccine available. We don't usually give it to everyone unless you are traveling. So if you're going to a country where it's endemic, it's recommended that you get the vaccine. Hepatitis B, HBV, this is a virus that is spread through blood, okay, or contaminated bodily fluids. Blood, semen, and vaginal fluids. It generally causes a flu-like illness with some diarrhea, nausea, and a swollen liver. Okay? And in about 50% of cases, this will last for 2 weeks and then completely go away. Okay? However, in the other 50% of cases, it results in a chronic infection that lasts with the patient for the rest of their life. And out of those 50% that have the chronic version, 10% will eventually develop cirrhosis or even cancer within the liver cells. Okay? Cirrhosis is scarring of the liver tissue, and when this happens, the liver then stops to function or doesn't function as well. Okay? This is primarily transmitted through sexual contact, but we also see it transmitted a lot from mother to baby during delivery. It's not very common in the United States because of the hepatitis B vaccine, which most of us get. However, in other portions of the world, especially in Southeast Asia and in China in particular, hepatitis B is still pretty prevalent. The good news is the Chinese government has realized this and they're stepping up their vaccination game, and so hopefully we'll see less and less of this as time goes on. Hepatitis C virus. So hepatitis C virus is also transmitted through contaminated bodily fluids, and the fluid that's most often associated with hepatitis C is blood. Okay? We used to think of it as potentially sexually transmitted, but nowadays we just think of it more as a blood infection. So this is usually associated with intravenous drug users who use dirty contaminated needles, okay? Or people that get contaminated blood products, or tattoo parlors that don't change their needles or clean them properly. This is often called the silent epidemic because when you get infected, you have no symptoms at all. It's much like HIV, where you have decades of no symptoms, and then all of a sudden your liver just starts to crash, become cancerous, and it could potentially fail. Okay? The good news is that there is a vaccine, or not a vaccine, there is a cure, a treatment for hepatitis C. However, the cure, it costs about $100,000 to do, and not a lot of insurance companies pay for it. But there is a cure for it.
What is it?
It's a pharmaceutical drug.
Oh, that's
It's
why-
basically a couple of HIV medications with one additional new medication. And that's it.
So that's why you see all the TV commercials for it. Did you know, Peter, when you
Yep.
get cured?
Because it costs the same as a house. All right, so now the rest of this chapter is going to deal with helminth infections. Okay? Helminths, as we talked about before, are large multicellular parasites. The reason why we're going to primarily talk about them at the end of this chapter is because they often use the GI tract as part of their life cycle. Okay? Now, helminths in general tend to not cause many symptoms on their own. Okay? These guys have evolved or co-evolved with humans so that they can get in, stay in us, and do nothing to cause symptoms at all. However, sometimes your immune system will see these guys and they're the ones that actually cause the symptoms if there are any. Okay? So it's not the worm itself doing the damage, it's your immune system. And that's primarily by causing eosinophilia. Remember, eosinophils are those immune cells that are designed to get rid of big parasites. These guys will create walls around the parasite, causing eosinophilic granulomas, and this then can result in damage to that tissue. Now, these organisms, as I said, are large multicellular eukaryotes, which means they're pretty evolved, okay? And so for that reason, they have very specialized virulence factors. Most of the time, these virulence factors are specialized just for humans. Some examples of these are specialized mouth parts, like serrated teeth. They can burrow through the skin or attach to the small intestine. Enzymes, which they use to break down tissues, and something called a cuticle. Cuticle is basically the same stuff as your fingernail, kind of thick keratin, covers the organism and protects it from the immune system. Again, it's usually not the organism itself causing the symptoms, it's your immune system targeting it and then subsequently destroying some tissue in the process. And the definitive host is the host where the organism wants to replicate. Okay? Most of what we're going to talk about today, the human is the definitive host, which means it wants to replicate in us. And what that often means is that it causes very, very little symptoms in humans. The ones that are problematic for us are where the definitive host is some sort of other animal, like a pig or a raccoon. And that's because when you get infected with one of those guys, they get in you and they go, oh shit, this isn't a raccoon, I don't know what to do, and it just goes anywhere, okay? And that's where it goes into the brain and can cause death, all right? But the guys that target just humans tend to be very mild and have learned to not kill us, otherwise they die as well. Now, helminths tend to follow 4 basic life cycles. So the first life cycle is relatively simple. You have eggs that are released into the environment. These mature into larvae, which then can be ingested. These larvae are then released in the stomach, travel to the larger small intestine, become adults, mate, and release more eggs. The next life cycle B is where larva is released into the environment directly. And then these larvae often break through the skin by eating or serrating through the skin tissue. They then get into the bloodstream, okay? Hitch a ride from the bloodstream into the lungs, where you cough them up, swallow them, and then they get into the GI tract. Once in the GI tract, they become adults, mate, release eggs, and continue the life cycle. The cycle C, this is where you need an intermediate host, okay? This intermediate host is usually some sort of animal we like to eat, like cows or pigs. In this case, eggs are released in the environment, usually in grass. Cows eat the grass or with the eggs on it. These become larvae, migrate through the GI tract of the cow into the bloodstream, where they then go and target muscle. Once they're in muscle, they encyst, and then they wait for the cow to be slaughtered and us to eat the meat. Once we eat the encystment, they get into the GI tract, become adults, mate, and release more eggs. And then the last life cycle is the most complicated one, and this is where you have 2 stages of larva and an intermediate host. In this case, you have eggs that become the first stage of larva, known as a mycelium. This then infects a freshwater snail and matures into the second stage larva, known as a cercaria. This then burrows through the skin, okay, of a human, gets into the bloodstream, and then targets either the liver or the bladder. Okay? It can cause hepatitis-like illness or bladder blockage and the inability to urinate.
Can we see them like burrowing?
No, they're small larvae at that point, so probably not. But a lot of times you can see where they burrow. Okay, and we'll talk about that in a second. How do we diagnose these? Well, oftentimes it's by looking at shit. Okay, you take the shit, you break it up, you look at the eggs. Eggs tend to be very distinctive for each different species. So oftentimes you can just look at the eggs under the microscope and determine what the organism is. Also, there are often a lot of serological tests available for these. So you can take some blood and look for antibodies to the organism. How do we prevent and treat this? Well, there are 5 drugs available and they all work very well. And that's because these guys are large multicellular eukaryotes, which means they evolve very slowly, which means it's difficult for them to develop resistance to these drugs. We can take them as prevention, which means you take them before you get sick. This will prevent the infection. Or you can take them as treatment. Okay? But keep in mind, these often only work on one stage of the life cycle. So either the larva or the adults. And if it targets the larva, then you have to wait for these adult worms to die of natural causes. And so that means you could be on these drugs for years at a time. All right, so the first worm we're going to talk about is Tricharias trichura, also known as whipworm. Okay? It's called whipworm because when you ingest it, the larvae burrow into the large intestine and then whip their tail around. Okay? They don't actually burrow all the way through, so they don't get into the bloodstream. They don't cause any serious infection per se. They don't really hurt. A lot of times you don't even know you have it. However, in some cases, especially if you have a large amount of worms, you can develop dysentery or bloody diarrhea. And the biggest problem with these guys is loss of muscle tone or rectal prolapse. If you get a large amount of these worms, they burrow in so much that they destroy the muscle and the rectum just comes right out of the anus. Okay. That requires surgery to repair. But again, the good news is that you need a lot of worms for this to happen. Just have a little bit, probably not that big of a deal. Enterobius vermicularis, also known as pinworm. Okay? We talked about pinworm before, earlier on in the semester. This is the one where when you ingest the organism, the larvae go to the small intestine, become adults. These adults then mate, and while you're sleeping, the female will then migrate out of the anus and deposit eggs around it. Okay? These eggs are sticky and immunogenic, so when you wake up, you scratch your butt, you get the eggs on your hands, you then can either auto-infect yourself and continue the cycle, or you can go and infect your buddy. Okay? Generally speaking, they're completely harmless. They don't burrow into the bloodstream, they don't cause any other serious problems. However, you can get a little bit of a sleep disturbance because they're migrating out of your anus while you're sleeping. Nausea, abdominal discomfort, and diarrhea. Okay? In fact, most of the time, people don't realize they have this until they start to poop out worms. And that's usually because they've had it for so long that they keep infecting themselves over and over and over again, and there's just so much worms that they all come out. Okay? This is one example of a helminth infection that's still pretty prevalent in the United States. Most helminth infections are rare in the US, and that's because we're very hygienic and clean and we separate our waste and things like that. However, this guy still occurs a lot in the US, primarily in kids and daycare settings. And that's because it's very difficult to get rid of, because these eggs are very sticky, very hardy, and kids like to suck their thumb and do weird things, right? So they may scratch their butt, not realize it, suck their thumb, and touch their friend or something like that, and continue on the life cycle.
Is that the one that you have to put tape on their butt?
Yep, so that's usually how you diagnose it, double-sided tape on the rectum or their anus. So yeah, it's a little gross to do that to your child, but do what you gotta do. Tiniosolium. So Tiniosolium, also known as the human tapeworm. Okay? So this is the one that most of us think about when we think of a helminth infection. These are those long worms, they can get up to 5 meters in length, and that's because they just snake around the convoluted small intestine. These guys have specialized mouth parts called a scullix. It's basically a little serrated kind of tool that they use to attach to the side of the small intestine, and then they just hang out there taking in some food. Okay? Most of the time they have absolutely no symptoms at all. In fact, it's not that big of a deal for you to be infected with these. They're relatively harmless. However, if you have a large number of these organisms in your gut, then you can start to develop things like anemia because you're losing too much nutrients. Okay? But generally speaking, not that big of a deal to have. The way that you get diagnosed with this is you look for something called a proglottid. And a proglottid is about a postage-sized stamp piece of fleshy tissue. Okay? These are one of the segments that fall off of the tapeworm. Each one of these segments has a male and female reproductive tract, which mate and then fall into the feces and then excrete from the body, or then continue on the life cycle. There are many other types of tapeworms, okay? And most of these are very, very similar to the point where we usually don't try to diagnose them, okay? We just all call them human tapeworms and treat them in the same way. All right, so now let's talk about the organisms that not only target the GI tract, but they usually migrate around the body, okay? The biggest problem with these organisms is wherever they migrate, they can cause immune reactivation, okay, or stimulation. This can result in redness and inflammation, okay? And if you have a lot of worms, in some cases this can cause things like pneumonia, which can potentially be serious. So the first one is Ascaris lumbricoides. So this is the most common helminth infection in the world, okay? This guy works by you ingesting eggs